Shift your care to a palliative approach. What does the term palliative mean to you where you work?
People are palliative when they are registered for benefits.
People are palliative in the last days of their life.
People are palliative when their care changes from cure to comfort.
These narrow understandings mean you are missing most people who have chronic life-limiting illnesses such as heart failure, COPD, renal failure, dementia, and frailty. We want to shift your thinking to include a palliative approach. Be proactive. Have conversations earlier to add palliative dimensions to care for all people who are living with and who will die from chronic life-limiting illness. Help the person and their family understand the chronic disease path and where they are along the illness journey. Blend chronic disease management and palliative approaches to care. Tailor knowledge and skill to different populations. Adjust systems of care to integrate and embed a palliative approach into usual care processes. Why shift your care to a palliative approach? Most people with chronic life-limiting conditions who are at risk of dying are cared for by people working outside of specialist palliative care settings. Families could be better prepared to make decisions. Earlier anticipation and managing symptoms reduces suffering. If you knew that someone you care for might die in the next year, what would be important to them, to you, to your family?
Meaningful conversations so we know what to expect.
Information, so we can think about the decisions that will need to be made.
Treatment choices based on what my mom values.
Do I have the confidence to have these conversations? What if I hurt their feelings?
Do I have permission to discuss advancing illness and the changes I see in this resident?
Do I have the skill?
What would you do differently if you had the confidence, permission, and skills to include a palliative approach? It takes a team, and everyone within the nursing family has a role. We'll show you how.
What is your understanding of your illness? What has your doctor told you?
I am seeing changes with Mrs. Smith, and I wouldn't be surprised if her health continues to change.
Let's further assess Mrs. Smith and then talk to her family. We're noticing some change in your mom. Can I talk with you both about what we've been seeing?
Thank you. We've noticed some changes in Mom too.
Next time you are in, let's sit with your husband and talk about the care plan to see if it still meets his needs and wishes.
It's a relief to feel prepared for what's going to happen in the future.
We've made some adjustments to your medication. How are you doing with your breathing?
Make sure you talk to your home care nurse about the decisions you made while you were here. And if it's okay with you, I'll send her this information.
A palliative approach can help provide better care to your patients. How can you use it where you work?
I have many people on my caseload who don't qualify for benefits, but can be helped by a palliative approach.
I know most people living in residential care would benefit from a palliative approach right from the time they move in.
I recognize that people with chronic life-limiting conditions can benefit from a palliative approach, even while they are receiving active disease-oriented treatment.
You've got it. Shift your care to a palliative approach.